Brilliant. So I'm Paul Johnson. I'm a nurse by background and a group analytics psychotherapist, and I came to Norfolk some 13 years ago working with children in Lowestoft, so it's quite nice to be here, even though I've got a very different role now. My role now is organisational development lead, so that's quite a large title, but really in essence what I think about is organisational culture within Norfolk and Suffolk Mental Health Trust, and I think about leadership and leadership development. So it's a bit about, not just about what we do, but about how we do it, how we take things forward. Last year, our organisation started thinking about morale within the services. We really acknowledged that our staff team didn't really connect with the organisation, but our service users were saying that they got a really good experience. CQC backs that up, and the CQC said, actually, it can't continue like this. So the CQC are our regulators about how we do things. CQC said, you know, some of our service users said that they were getting a really good experience, but our staff were really particularly unhappy. And we set about refreshing the trust values. So we went around and we spoke to staff, and in essence what we said is, what sort of things make a really good day for you? What sort of things make a difference in terms of how things are done around here? And likewise, what sort of things really act as the blocks and the barriers for the work that you do? Likewise, we went to our service users and carers and said, what sort of things make a difference in terms of how you access services, and what sort of things kind of put you off? So we had 1,200 people involved in our services, nearly 2,000 hours of listening, and we drove around anywhere that would have us, really. So I felt like a bit like a travelling salesman. I went around with little stickers and pens and post-it notes saying, tell us about your experience. I have to say, I went to Aldi once, I'd left my sticker on, and the checkout woman said, oh, what's putting people first? And I started asking her about her good days and bad days in Aldi, even though it didn't necessarily fit. But it was the first time we'd done something on such a large scale, really going out and listening to people, finding out what makes a big difference. So we thought about our service users and carers, our staff and our leaders, our managers. We didn't do enough in terms of our service users and carers, and what we realised is actually you don't know what you don't know. So we spoke to people and said, well, who should we speak to next? And it gained momentum, but by the time we got to where we needed to get, I think we just left it too late. So first thing that I would say is this can't be a one-off. We need to go out and we need to make sure that we speak to people regularly about what it is that we do, and to listen to people about their experiences. Interesting enough, some of the stuff that you've covered this morning isn't new, but it's about how do we build on that and have an ongoing conversation. So the feedback from staff, they said, at long last, you're listening to us, you're having the conversation. People really liked the process. They didn't feel so isolated by what they were feeling on a day-to-day basis. They felt a bit sad, I have to say, that we had to go through this process. Likewise, our service users, and I'm not sure if you can see that, I don't think it works well on the colours. Our service users said, actually, we'd like to get involved, really. We'd like to give you some more feedback. You know, you don't listen to us often enough. But they liked the process. So I'm going to talk you through what we heard. So our service users and carers, what they said they valued most. And that was about being valued and being welcomed. Felt valued, felt like I mattered. It was nice staff, people felt approachable. One of the stories that jumps to my mind is that someone said, you know, I go along, I've been going along to services for about 6 months, and I've got 2 receptionists. One knows my name, and the other one will say, what is your name? And she says, I know, I go to Tesco's, and someone will say, oh, you've had your hair done. So there's something about actually how we just treat people, and likewise what it's like when you walk into reception and you sit down, and actually there are out-of-date materials on the wall that don't mean anything, or that, you know, the place is just looking a little untidy. You know, not big things, not things that cost lots of money, but things that really matter in terms of how people feel cared for. So again, people said being listened to, being supported, being understood, help being professional staff, not being lost in the system, and I think someone talked about that earlier on, for someone being lost in the system, not really sure where they are. Being involved and being connected with people, and again, I think that sense of you're not so isolated. There are other people who have very similar sorts of issues. Really helped people to feel quite connected, and it's that social aspect again, I think, as we talked about youth. Again, being empowered, put in charge. So people didn't necessarily use words such as recovery, but they talked about issues around recovery. What people said they didn't like, and it's the mirror opposite. It's the not feeling valued or respected, not feeling supported, not feeling heard, unhelpful and busy staff having really long waits. And someone described going to a stress management group and said the member of staff was so stressed I ended up wanting to leave because actually I could just feel it. It wasn't necessarily helpful. Left without any help or a point of contact. So again, that sense of, that's great. What do I do at the weekends? It's great 9 to 5, but my problems don't necessarily stop on a Friday at 5 o'clock. A level of negativity. So again, coming through staff, just coming through the areas, it's in the culture of what people were feeling, and not necessarily being helped to help themselves. Similarly, staff said what we want. They like, we didn't put it word for word, but cake came up as a big one, and everyone was talking about food. Everyone liked cake, it seemed to be a real biggie. But lots of laughs, warmth, humours, getting things done. Our staff come to work because they want to do the work. They want to work with people, they want to really make a difference. So it's doing that stuff, team spirit, patient contact, giving enough time for people who needed the services. Likewise, they said there's no time. Some of our caseloads are unmanageable, increasing demands, there's no energy to do things, poor staffing, there's a vagueness, and again it goes back to the connection with the wider organisation. We're not sure the direction it's taking place. Negativity, confusing IT systems. So our service users talked about, actually, what do they want more of, what do they want less of? So more of, we want somebody who can listen well, someone who's professional, someone who's caring. Smart appearance makes a difference. What they want less of is the sticking to the tick boxes. We talked about risk earlier. I think John was talking about risk and risk assessment. And again, what people said is sometimes it feels like it takes me ages to get into the door and to sit down. And the first thing that you do is shove forms under my nose and get me to sign forms before I can have a conversation about why I'm here. That's not helpful. And that just makes me feel that all I'm doing is signing off that I won't do anything in order to have a conversation. Not being listened to, being patronising. And what we got, the message that we got was actually the process before people doesn't help. It doesn't help at all. This is just a little bit about what people said they wanted to do more of and less of, but I'm aware of my time, so I'm going to move on. And I am around all day, so we'll have a conversation. So the values bit, and why we think values are more important, the values bit's around actually how do we get more of what we want? How do we get more of those good days and less of the bad days, less of the blocks and barriers? And it's not just about what you do, but it's also about how you do it. And it's about trying to create a bit of a sea change in terms of what you do and how you do it. And we had over 100 people co-creating the values. So all the post-it notes that we pulled together, and we had thousands of post-it notes, we went back and we did some analysis. We looked at the similar words that were being said, and what I didn't say actually, with the wordles, when you see the wordles, the larger the word, the more times someone's mentioned it, which is why they get bigger than some of the smaller words. So we went through and we had a look and we tried to understand what was being said, what was coming through, and we tried to refine it. So again, we wanted the language to work. So we had staff sessions and service user sessions that people were involved with to come along to talk about what the values should look like. And this is what we came up with. So this is what's on your chairs. Working together, respectfully and positively. All of these words didn't come from the board, they came from our staff and they came from our service users. And I'm pleased to say you're getting a bit of a first look. We haven't launched them yet, but the board signed them off yesterday, and so I was really keen to come along and bring them to you. And I guess as you go off for your lunch, this is a bit of the working lunch perspective. This is great, and I'm really pleased with this, because actually I do think that the work's gone in to really go and understand what's happening for our staff and our service users. We're going to need to do it again, and we're going to need to continue doing it, so it's not just a one-off. But actually, what does it mean? If we're not careful, all that will happen is there'll be a brand new lanyard, and there'll be a nice shiny poster saying, working together respectfully, positively. So outside, I've got a pen for you, I've got a sticker for you, and I've got loads of post-its. Because what I'd like to know from everyone in the room, if we were getting this right, what things would be happening? What would it look like? I think we've already mentioned some things in the room already, that sense of, actually there'd be a sense of being a bit more involved, a bit more included, maybe more of these sorts of sessions. What would it look like if our values really are getting it right, if we are getting it right? We've got a plan, we've got a 4-year plan, you know, about how we put values into how we recruit people, how we do appraisals, all sorts of things, and that's great. But I think for me, it's going to be start teasing it out now. What does it look like for you? If we get it right, what would you see? And I've done it in under 15 minutes, so I feel really pleased.